So clients often ask, is pain necessary? So let's talk about pain. Uh, we want to discriminate between physical pain, like if you drop something on your toe, and emotional pain. Uh, Emotional pain is one of several, 10, uh, what are called affects that we are genetically programmed to experience. And it's generally, it's called distress, anguish. At the lower level, it's distress. At the highest level, it's anguish. And this is emotional distress. It's sadness it's always the emotion of too much. If a pet dies, a loved one dies, there's too much separation. And that's the too much piece. And that triggers the signature of sadness or distress anguish, which is tears, and often a heaviness in the chest pulling down here. And when it gets serious enough, people's chin will start to quiver. So with the work that I do, I teach clients how to recognize when they're feeling sadness, how to tolerate it, how to regulate it. So when we do the deep uncovering work, after they've learned the skills of emotional regulation, I will always tell the client, now, if this gets too distressing for you, remember you have your skills. You can recognize what you're feeling. You can use your grounding resource to help you stay in the present moment when you're feeling that emotion, and you can notice yourself having the emotion, and furthermore, you can use your disposal resource to decrease the intensity of that emotion. And so it's also the case that when people have done the emotional regulation piece, they are able to witness themselves having an emotion as opposed to becoming that emotion. Anger is a good one to illustrate this, but sadness is the same, or distress or anguish. It's before people learn the skills of emotional regulation, as I said in another video, and the right brain gets activated, they become their emotions. Or another way of saying it is their emotions have them. After they've learned these skills of emotional regulation, as their brain develops and becomes more competent, as they become more of a whole person, they can say, you know, I'm feeling sad right now. And they're aware of the sensations of sadness, but they haven't completely succumbed or been completely overwhelmed by the emotion of sadness and or of anger. So they can say, I'm feeling angry right now, rather than actually becoming angry. So going back to the question that we started with, is pain necessary? No. Let me put it this way. It's not. Intense pain is not necessary. It's not even advised. So because in doing the uncovering work, going back to the experiences of childhood, it's very important that the client be able to maintain an adult perspective so that we can help the child part that's within every client who comes with an eating disorder, an addiction, or depression, or anxiety. And so this is the fundamental work. So recognition of pain is necessary, of emotion, of distress and anguish, but to be overwhelmed by it, this is where I disagree with the exposure therapies, because it's possible, by teaching the skills of emotional regulation, remediating the deficits in emotional regulation from childhood, that the client can process painful childhood experiences without having their personality disorganized by it. So, thank you.